Excellencies, esteemed colleagues, I am pleased to present the Royal Academy of Science International Trust vision in this high-level panel, which is held in the Republic of Lebanon, a country that my family and I share not only long history, but present and future with. I have had a long-held respect for Lebanon, a country that fosters its legacy through the power of its people, the experts in science, education, health, and the arts, and this gives me hope that the participants and attendees of today's meeting will be able to bridge the world through collaboration and partnership from which all humanity will benefit. The work of the Royal Academy of Science International Trust speaks for itself, including humanitarian aids, the Science Cafe, Anwan Youth Radio Program, youth empowerment, intergeneration dialogue, public awareness and education on reproductive health and medicine, and the advocacy program to prevent misusing of human gametes and embryos, among others. In most mentioned programs, we collaborated with Dr. Ismail Sukarriya. Ladies and gentlemen, the Royal Academy of Science has been founded in 1968 by the late His Royal Highness Prince Mohammed bin King Faisal I of Iraq El Hashemite, who wrote on 17th April 1968 in the preamble of RASIT's constitution, and I quote, "All human rights issues have sustainable development dimensions. To achieve sustainable development, we need to promote excellence in education and science and its influential role in socio-economic policy and development. The scientific and technological revolution is transforming the way we live, think, and make decisions in order to maintain advancement in sustainable social and economic development. It is essential to focus on the role and impact of scientific research institutes, both on the national and global scale. Certainly, how we conduct, connect, and deal with science content, various fields, issues, and organizations, and the way we foster the talents working within this multifaceted sphere that influence socially sustainable development programs. If our goal is to reform and develop society sustainably, we must first and foremost empower scientific competencies in parallel. That was the vision of and the goals of His Royal Highness Prince Mohammed, may his soul rest in peace. Excellencies, esteemed colleagues, since 1968, RASIT has been working towards sustainable development through the work of experts and policymakers, whether through its Sustainable Development Studies Center, founded in 1982, or through programs that are all designed to serve the people with a clear focus on social aspects and cultural dimensions. Our journey in sustainable development continues through the well-accomplished collaboration and partnership with the United Nations and its agencies and departments, as well as with member states and regional organizations. RASIT continues to bring the United Nations 2030 Sustainable Development Agenda and its 17 global goals closer to the people, its ultimate beneficiaries, without leaving anyone behind. Whether the peoples are experts or not, our work is to show the impact of the people as agents and beneficiaries in the process of implementing Sustainable Development Agenda. Let me give you some prime examples from the work of Dr. Ismail Sukarriya. Dr. Sukarriya's work is focused on healthy humans, which is the backbone of human development programs. He defines poverty as the lack of health, education, and other social services, and also he works on narrowing the gap between different social groups to ensure national and international stabilization and peace at all levels. He studies the usage of chemical pesticides in agriculture and its connection to the high level of GIT cancer, the pollution of water resources, including river and the sea, and its impact on life below water and the human well-being, and air pollution and lung cancer. Apart from his academic pursuits, he also works on training youth, empowering women and girls, reducing inequalities within the country, among others. If we look at his work, it achieves and implements almost all of the Sustainable Development Goals and their targets. Dr. Sukarriya has worked on almost everything. The only two things he did not work on are the importance of renewable energy for health and dignity and the inclusion of disabled, particularly the deaf and blind. Dr. Ismail Sukarriya, you may say, what on earth I have to do with renewable energy when I am a professor of medicine? Whether in Lebanon or worldwide, we can achieve the human rights approach for health if we use renewable energy system in health institutions and clinics, among other places. Not only do we save people's lives during energy crisis, but the redirected funds can be deployed into social services, including health and education. This was in fact the end result of the first postgraduate thesis about sustainable development goals and the 2030 agenda, which was presented in 2016 at University College London by RASIT's intern and youth representative to the UN, Ali Farhat from Lebanon. Ladies and gentlemen, the subtitle of the 2030 agenda is Transforming Our World. Indeed, fundamental transformation in the way the world lives, works, and does business are needed to achieve human rights and dignity. We need to transform for people and for planet, to transform how we understand and how we strive for prosperity, and to travel a road to transformation based on peace, stability, equity, inclusion, and partnerships. We need to unlock the full transformative contribution which scientists and experts, including women and youth, can make to our world. The challenges facing the world's countries, its prosperity and economy, creativity, exchange, equity, and opportunity will be met only if we deploy women and men in science, knowledge, skills, and methods of inquiry ever more intensively. Dr. Sukarriya, we have been collaborating for more than 15 years. The success of our collaboration is based on respect, partnership, and the way we conduct work. We treat the cause of the disease, not the condition. This is our holistic approach to human rights and dignity. Excellencies, ladies and gentlemen, RASIT Science Cafe program started in Lebanon, and its motto was "From Lebanon to the world, developing menu for your mind." And today, we witness the beginning of a global movement. From Lebanon to the world, health is a human right and dignity. Ladies and gentlemen, finally, I would like to sincerely thank His Excellency, Mr. Abdullah Shahid, the United Nations President of General Assembly, the Director General of the World Health Organization, my dear colleague, His Excellency Dr. Tedros, my dearest friends and sisters, Her Excellency Dr. Helena Dali, the European Union Commissioner for Equality, and Her Excellency Professor Amina Ghuraib Fakim, the 6th President of the Republic of Mauritius. I also would like to sincerely thank Her Excellency Ms. Nadan Nashif, the Deputy High Commissioner for Human Rights, and the acting regional representative for MENA, Mr. Ulrich Halstein. I also would like to thank all colleagues and friends speaking and attending today. Further, I would like to thank the American University of Beirut for hosting this high-level panel. Dr. Ismail Sukarriya, Rumi, the famous Sufi, rightly said, "You are not a drop in the ocean, you are the ocean in a drop." The Royal Academy of Science, International Trust, renews its commitment to the Universal Declaration of Human Rights and its articles, including Article 25, and we ensure you, Dr. Sukarriya, that we will continue working with you in the campaign Health is a Human Right and Dignity. We also congratulate you on your achievements, and as I always say, are we done? Not yet. The best is yet to come. Excellencies, esteemed colleagues, I thank you.